Assalamualaikum. My name is Siti Nur Hidayah, and today I want to present about my preparation before I'm starting my clinical and the knowledge I get during the clinical. Before starting my clinical attachment, I prepared myself by reviewing some basic principles of radiotherapy, such as the purpose and type of the treatment. I also made sure to understand important terminologies like dose, fraction, and margin. Besides that, I revised the key anatomical areas such as the head, pelvis, breast, and thorax, since the main cancer cases treated are breast, prostate, brain, cervical cancer. Most importantly, I learned how to manage and communicate with patients respectfully and with empathy. I was assigned to Hospital Councilor Tunku Moncrief in Cheras. For transportation, I used public transport, mainly the LRT, which took about 1 hour to reach the hospital. On the first day, we were introduced to the facilities and different sections in the radiotherapy department. We were also briefed about the treatment flow, how patients receive the therapy, and how often they need to attend the session depending on their condition. Every task or case we handled had to be verified by our supervisor, Madam Ainun Zubaida, and for task distribution and guidance, we referred to the head nurse, Madam Nur Hayati. The radiotherapy and oncology department at HUKM is led by the head of department together with the oncologist medical and the physicist therapy radiographers and nurse. The department has several main units, which is the oncology clinic, simulation room. Their position is set during in the city. Next, in the planning room, the treatment plan and radiation dose are prepared. Finally, in the treatment room, patients receive the radiotherapy using the linear accelerator. The medical physicist unit also check the machine and ensure the safety. The whole process from the consultation to treatment and follow-up works together to make sure every patient gets safe and effective care. The head of department is Professor Dato Dr. Fuad Ismail. Apart from him, there are also a unit leader of the treatment, radiotherapy clinic, and the oncology ward. My group was placed in the ward section, which was monitored by the head nurse and supervised by our clinical instructor, Madam Ainun Spaida. In the radiotherapy department, the main machine used is linear accelerator, which is the LINAC. It produces the high energy X-ray and electron to destroy the cancer cell. Different techniques like 3D, CRT, IMRT, and are delivered using this machine. Before the treatment, a CT simulator is used to scan the patient and mark the correct position. Then, the treatment planning system or TPS is used to design the radiation plan and calculate the right dose. Then, some cancers are treated using brachytherapy, where a small radioactive source is placed inside or near the tumor. During the treatment, imaging systems such as cone beam CTs help to check the patient position and accuracy. Finally, medical physicists use dosimetry. Medical physicists are use dosimetry and Q equipment to make sure the machine and dose are safe and accurate. All these technologies work together to give a precise and effective cancer treatment. As radiotherapy trainee, our main role is to observe, learn under their supervision. We watch patient consultation and learn how to communicate with them. In the CT simulation, we help with patient positioning, immobilization, and we observe the treatment planning also, how the tumors and organs are contoured and how those are calculated. In the treatment room, we watch the radiotherapy being delivered using the LINAC or brachytherapy and how imaging is used to check the accuracy. We also learn about the machine safety, quality checks. Finally, we keep record and follow the patient workflow from referral to follow-up. All this help trainees gain knowledge and understand safety and prepare for future works. Here, some tips to help you during the clinical posting. First, prepare early for revised anatomy, type the radiotherapy principle, and know the workflow from the referral to the treatment. Observe actively, like watch procedure carefully, take notes, and ask polite questions to understand the process. Learn how to communicate with patients gently and supportively, and always check their comfort during the positioning. Safety is priority, the most needed thing you need to know. Follow the radiation safety rule, PPE, never touch machine or patient without supervision. Keep the detailed logbook of all the activity for reflection and assessment. Finally, Have a positive and proactive attitude. We should be ready to learn, don't afraid to ask questions, learn from the senior physicist and radiographer. Following these tips will make your clinical posting safer, smoother, and more rewarding. During the clinical posting, ethical and professional behavior is more important. First, always respect patients and keep their information confidential. Treat them politely and be sensitive to their needs. Always follow the safety rule, especially with the radiation and equipment, and never perform procedure without supervision. Be sure, reliable, and account for your action. Work well with the whole team such as doctor, physicist, nurse, and other staff. Maintain a professional appearance and attitude. Communicate clearly and respectfully. Finally, be curious and reflective and ask questions politely. Take note and learn from every experience. So that's all from me. Bye.